So the title of the talk today is lifted from Esselstyn and Campbell. They did a series on forks over knives. There's a cookbook. This recipe didn't come from that, but there is a cookbook and there is a video. How many of you have seen that, forks over knives? When I first saw that, I thought, well, what do you mean, forks over knives? Do you have to eat with a knife, or is it a fork? Or I prefer a spoon, personally. But what they meant by that is simply, which is better way to treat coronary artery disease or atherosclerosis? The way we eat, or to see a surgeon or a cardiologist and have bypass surgery or a stent placed. So which is the best way to treat coronary disease? Well, the best way to treat it is not to get it, right? And some people can eat any way they want and they never get it because they did a really good job of choosing their parents. And for the rest of us, we have to be careful how we eat. That's particularly true in my family. As I've told you before, my grandfather, who was a physician, dropped dead at 55 of a heart attack. And my father had heart disease in his 60s despite a pretty good diet. And my brother had had 3 heart attacks by the time he was 60. And so, being that I'm younger than he is, I learned a lesson. And I thought I'd try to be more careful. Does that mean if I eat perfectly, I'll never have a heart attack? No, because you can have heart problems just from stress. I had a patient come into my office some years ago now, and she had a perfect cholesterol. She was thin, she was fit. Her cholesterol was like 120, and blood pressure was great. And I said, well, you know, you should do well for a long time. Less than a month later, I met her in the emergency room and she was having a heart attack. Well, what had happened? Well, she had gotten into an argument and gotten quite stressed, and that stress brought on a heart attack. And we dissolved the clot in the emergency room here when this was a hospital and sent her emergently down to Maine Medical, and they did a coronary artery catheterization, and her arteries were all wide open. It was the stress that had caused her heart attack. So you can have perfect arteries and still have a heart attack. And that's important to remember. But in those of us who are subject, not only by genetics, but also by the way we eat, to coronary disease, is it possible to prevent it from that, heart attack? Remember that 40% of the time, the first evidence that you have any problem with your heart is that you drop dead. And that's too late to fix, right? And that's sudden cardiac death. Fortunately, there are 60% of the time that doesn't happen and we can intervene. But which is the better way to treat coronary disease? And the answer to that is it depends. If you are having a heart attack, in the process of it, do not come and talk to me about diet, okay? That's not the place. That is the time and place for going to the emergency room as quickly as you can and then being transferred emergently, in the right setting anyway, emergently to a center where they can do a cardiac catheterization and hopefully a stent or angioplasty and a stent. And sometimes you need a bypass. So in the setting of an acute heart attack, don't talk to me about diet, okay? That's not the place. Mortality is markedly reduced in the setting of an acute heart attack if you have an intervention by a skilled cardiologist or surgeon or a team of both of them. So no question, hands down, if you have coronary disease and you're having a heart attack or you're having what we call unstable angina, get something done. But what about other situations where you go to the doctor, you've been having chest discomfort, with exertion. And if you sit still, you don't have it. And if you get stressed, it comes on and then it eases up. What in that situation? And that we'd call stable angina or angina, whichever way you want to call it. What is the best way to treat that disease? And if you've had a heart attack, what's the best way to treat that? Or if you have a really strong family history like I do, what's the best way to treat those risks? And that's what I want us to think about tonight. So in the setting of an acute heart attack or unstable angina, knives or surgical or cardiologic intervention always wins. Got that? Don't talk to me about diet when you have crushing chest pain. It's the wrong time. The thing to remember and balance to that is stents and bypass surgery do not treat the disease. Okay, you heard me. Stents and bypass surgery do not treat the disease. The disease is atherosclerosis, and a stent does nothing for that. It treats the symptoms, it opens the artery, just like a bypass does, but does not treat the underlying process. And I have patients who have gone in for a stent and felt great afterwards, and a few years later need another, and a few years later need another. I have several patients that have had 4 and 5 trips in to have something done because they didn't change the disease process. And we'd like to stop that, cycling in and out of the need for cardiac intervention. Why? Because a stent costs about $40,000 and a bypass about $120,000. It varies, but that's about an average. And with some dietary change and lifestyle change, you can definitely interrupt that. Well, first of all, let's look at what we can do medically, that is with medications. So if you take all the medications that the doctor gives you, but you say, look, don't talk to me about diet, I just want to do medications and I'll follow that advice, you can reduce your risk of having a recurrent event, that is another heart attack or unstable angina and needing another stent or bypass. You can reduce that risk by about 30 to 50%. Well, that's pretty good. That's about like flipping a coin. Yeah. Well, it's not quite as good as flipping a coin, right? It's only 30 to 50. Now, that depends on compliance, and that is, do you take your medication every single day? Are you taking the maximum dose of a statin? And are you taking all the medication? Are you following up regularly? Are you getting your lab tests? That sort of thing. If you're really careful with that, you can reduce your risk of recurrence by about 30 to 50%. I had a patient some years ago who came in and she had a cardiac event and she had a stent, and then we put her on all the medication and she said, don't talk to me about diet. And I knew that she was at risk for having a recurrence, and so we put her on maximum dose medication. And you've heard of LDL cholesterol, most of you, and you know that they recommend keeping it, now they say down in the 70s if you've had a cardiac event. Well, we drove hers all the way down into the 40s. And she still dropped dead at the breakfast table after a breakfast of bacon and eggs. You cannot overcome bad diet with the best medication. And that's really important to know. We know that if you put someone on a statin drug, there's a certain percentage of people that will liberalize their diet because they figure their medication is taking care of their cholesterol. Don't be deceived. You can take a statin all day long and it will not undo a bad diet completely. It helps, but it won't undo a bad diet. The best we can do with good diet, not perfect, but good American Heart Association diet and medication is 30 to 50%. Now, the American Heart Association is changing its recommendations, but its current recommendations for diet plus medication will buy you 30 to 50% reduction. And I don't like that. I'd like, a lot higher number. And so if you look at the data on full court press on dietary change, the kind I'm going to describe to you tonight, you can get that number up to 90%. Dean Ornish in his studies found that he could get it up to 99%. But in order to get it up to 99%, you have to eliminate some people from that equation. And we often do this in our studies. What kinds of people? People with inflammatory disorders like lupus, rheumatoid arthritis, and those autoimmune diseases, because those cause inflammation. And like I've said many times before, inflammation underlies all chronic disease, including coronary artery disease. So if you have rheumatoid arthritis and you follow a cardiac reversal diet exactly, I'd still recommend that you take a statin with it. Ornish's studies that he published in the best journals in the country and in the Lancet, that he didn't use any medication, and he still reversed coronary disease 99% of the time. But that didn't include people with inflammatory disorders. If you have an inflammatory disorder, that number drops. In fact, if you have lupus or rheumatoid or one of those diseases, I recommend, if your cholesterol's up, you consider taking a statin. I don't want you to think, well, if I'm good enough with my diet, that's good enough. Because you can get coronary disease very young. I have a patient who has lupus, and she was very healthy and she had a good cholesterol, and in her 40s she had a large heart attack, and she should have been on statins. We didn't know that at that time, but we do now. Recent data shows that psoriasis, like the other autoimmune diseases, raises your risk for coronary disease because of inflammation. Remember, atherosclerosis is a disease of inflamed arteries, and arteries that are inflamed over time clog up. And you can inflame them with diet, as we'll talk about, but anytime you have a chronic illness that causes inflammation, it raises your risk for coronary disease as well, and that's important to understand. So the best lifestyle changes, as I've mentioned, will reduce your risk for cardiac events by up to 90%, depending on compliance, and that's without statins. If you have a genetically elevated cholesterol, particularly elevated LDL or low HDL and high triglycerides, that risk can be lowered even further by taking statins. If you're an average person and you can get your cholesterol down with good diet, that's good. That's enough 90% of the time, which is wonderful news. Those, as I mentioned, with an autoimmune disease ought to take a statin. Caldwell Esselstyn, who did some of the original research and is still doing very well in his either late 80s or early 90s, I'm not sure which now, said this, and it's on your papers. Coronary artery disease is the #1 killer in America, yet heart disease is a toothless paper tiger that need never exist. If it does exist, it need never progress. And that's really true. If you are careful with your diet, and if you have a problem with one of these inflammatory disorders, you take a statin at a good dose, coronary artery disease need never exist. And if it does exist in you, it need never progress. and that's really good news. But diet, like medication, needs to be adhered to strictly if you're going to get results. I've emphasized this to my patients, but I've had it emphasized to me and those that didn't follow. I had a gentleman come into actually I did a treadmill stress test on him as a pre-op evaluation. He had a large melanoma on his face that needed to be removed, but his surgeon, when he was taking the history, found out that the guy got chest pain whenever he walked. And so he sent him to me for a treadmill stress test, and I did a treadmill on him, and I almost got chest pain. It was very abnormal, and I pled with him to go immediately into the intensive care unit because his treadmill was so bad. And he said, well, I've lived a really good life, and I don't want to go to the ICU. If I die, I die. That's okay. I said, yeah, but you're still functional. Yeah, but, and I said, well, would you take some medicine? Well, I'd think about medication. So I wrote out some scripts for him. He said, how about diet? I said, diet. I don't know, you're pretty, okay, let's do, so I said, walk down to my office and I'll talk to you about diet. But I said, go slow. So he came down the hall and around the corner and made it to my office without having a heart attack. And I told him, make sure you fill the medicine, and then I told him about the diet we're going to talk about. 2 weeks later, I saw him again, and he said, I feel great. I haven't had any chest pain recently. He said, I went and took a walk, and he told me where he went, and I couldn't believe it, so I went and took the walk with my wife, and he had gone on a 2-mile walk, and it was up and downhill and everything. He said, I haven't walked that far in 5 years, and I feel great. Well, I reviewed his stress test with a cardiologist, and the cardiologist said, that man has left main disease. That's a widowmaker. That's a serious narrowing of the coronary artery, and usually if you have that, even if you're not having unstable angina, they're going to recommend that you have a bypass. And that's the kind of disease he had. But with diet, in 2 weeks, his symptoms had gone away. He continued to do well. He took up canoeing again. He was doing great. And about 2 years later, I called him up and I said, there's another person that wants to talk with us about coronary disease. He has some and he'd like to not have a bypass. So would you come over and join us for supper? So he came, and after he was there, he said, I'm really glad you invited me because I've gone off my diet. He said, I'm still feeling good, but I've gone off my diet. I said, please go back on it. He said, well, but I'm feeling so good. I said, go back on it. You wouldn't tell the surgeon halfway through the surgery to stop, would you? But he didn't go back on it. And about 4 months later, he was out snow blowing his driveway and dropped dead in the driveway. You do not want to do partial diet, okay? If you're going to treat your coronary disease with diet, do it all the way. Don't cheat on it. At least not for about 3 years, because it takes 2 years to open the arteries up and then another year to stabilize things. Even then, I'd rather you don't cheat. But if you do, have your cardiologist handy and the emergency room not far away. Don't be cheating in the backwoods of Maine. That's not good. So I know that this can reverse coronary disease. I've seen it in my practice. I recently had an 89-year-old woman come into my office, and she was having bad chest pain. And I said, well, we can, talk about diet, because she was only having it when she exerted herself. And she said, I could never do diet. I said, okay, we'll send you to the cardiologist. And I set that all up for her to go have a coronary cath. And she called me about a day and a half later, and she said, I've changed my mind. Will you talk to me about diet? And I said, sure, let's talk about it. And so she changed with the help of her daughter at 89, and her chest pain's gone. She feels great. And so that's really important to know, even if you're advanced age and you're not having crescendo angina and you aren't having an acute heart attack, you can reverse your symptoms in about 2 weeks. And that's really good news. Unless you have rheumatoid arthritis or lupus or something like that, then you're going to need some medicine with it. Now, are there any risks to doing interventions? Why not just do them? Well, one risk is the cost, right? What are we doing to our health care? We spend about $60 billion a year on stents and bypasses. That's some serious money. And we ought to think about that. And how much do you spend on diet? Well, no more if you eat a good diet than you eat a bad diet, and you'll save on medication. So it's cheaper to go with natural methods than it is with the other. And if you go and have your bypass, it's going to take you longer to recover than the 2 weeks that I can get you symptom-free in, right? So you can get well almost as fast with diet as you can with intervention, except in the setting of acute MI. Are there risks to having some of those things done? Yes, there are. They've done studies with transcranial Doppler. That's where they set a Doppler or an ultrasound up here on your head and measure what's happening up here as they're doing a catheterization. 100% of the time, there are emboli to the brain during the catheterization. 100% of the time. Now, some of those are air emboli and don't cause long-term problems, and some of them are little tiny emboli and we can't see the problems that they cause. But in 15% of the cases, people that have had interventions have demonstrable abnormalities on MRIs of their brain afterwards. That is, little areas that have had stroke 15% of the time. Any of you have some brain cells you'd rather not live with? Well, I know a few people that have brain cells that I wish they did have, but I don't want to lose any of mine. And with these interventions, I mean, they're sticking this wire up through your arteries and coming up to your heart and then down into it this way. And you can imagine that some of that plaque gets broken off and heads north. Right? Well, it does. 15% of the time, there are demonstrable abnormalities out in the brain on MRI after a catheterization. It's less than 1% that you have what's called a stroke. Well, what do we mean by that? Well, we mean, if I look at you, you can still move both hands and you can still talk. Sorry about that. And there's no clinical evidence of a stroke. But you've met people that they're starting to slip with names and they can't remember dates. And if you look at their brain on MRI, there are multiple of these tiny little areas that are, we call mini strokes or small vessel disease. And that's the same thing you get when you get a coronary cath. So don't be cavalier about getting an intervention. There are risks to it. Every coronary cath, there are risks, and of course bypass too. So keep that in mind when you consider intervention versus lifestyle change. And one last thing before we talk about the diet, just because your cholesterol is at a good level doesn't mean you won't have a heart attack. I've had people in my office that had wonderful cholesterols and went on to have a heart attack because we're not measuring the right thing. We just don't. We measure cholesterol because it's a pretty good predictor of whether you're going to be at risk from heart disease. But what we should do is we should measure oxidized cholesterol, or specifically oxidized LDL. That's LDL that's been changed, it's been oxidized, or it's inflammatory, and that's what underlies all atherosclerosis. It can be measured, and it is measured in research, but not in clinical practice. One of the reasons for that is the measurements that they make on that aren't real accurate yet. They're not standardized really well. I hope eventually we'll be able to measure oxidized LDL because it's a much better predictor of whether you're going to have a heart attack or not. So measuring the level of oxidized LDL would be a much better way to estimate. So don't rest too easily if I tell you, well, your cholesterol's great. because you can be having a really good cholesterol and all of it's oxidized and you're still at some risk. All right, questions before we go on to diet? In the back. Okay, can I address the long-term use of statins? Yes, I can. The risk of statins is lower than, the benefit of statins is higher than the risk if you have coronary disease or if you have a very high cholesterol. But statins are not risk-free. They raise your risk of diabetes. But if you get diabetes, it's better to be on a statin than not. But if you changed your diet, you might not get diabetes. So, you know, we get around into this circular reasoning. How about statins and muscle pain? Well, a lot of my patients complain of muscle pain when they go on statins, and they tell me it's better when they're not on statins, because people tend to take medicines and then stop and play with them back and forth. I don't know why that is, but they seem to like to do that. And that is true that it occurs in some people. I don't know if that's because people know they're supposed to ache when they take them, and so they start to ache, but if you look at placebo-controlled trials, the incidence of muscle aching in those is very similar between placebo and statin. There are some people that have a reaction to statins and they can get necrosis of their muscles. I've seen one case in 30 years. Fortunately, well, it doesn't really matter. It wasn't my patient. Fortunate for me, but unfortunate for the patient. In any case, he was started on a statin and died from the statin. It's a very rare complication, but you can have myonecrosis of your muscles, and that's very serious, but very rare. The more common thing to see is an elevation of liver enzymes, because of course a statin works at the level of the liver and it can be harmful to the liver. And as I mentioned, it does raise your risk of diabetes. I would rather have a patient change their diet than take a statin, because it's cheaper and it's more effective. Remember, statins plus other medicine, you get a 50% reduction at most, whereas with good diet, you can get a 90%. I like that better. But good question. Any other questions? Okay, yes, question.
If you have normal cholesterol levels and blood pressure and everything, how do you know if you're at risk for heart disease?
Well, you talk to your doctor and you get them to do a risk calculator on you, and it can give you your percent risk over the next 10 years. And that's based on family history, smoking history, exercise level, age, sex, etc. And that's the best way to know. If you're eating an American diet, you are at risk for coronary disease. It's that simple, regardless of your family history. And the more stressed you are, the higher your risk. And the less friends you have, the higher your risk. One of the best things you can do for your heart is go make friends. You know, it's really interesting what that does for heart attack risk. I think good friends are maybe anti-inflammatory, I don't know. Bad friends can be inflammatory, but so go make good friends. So let me talk briefly about the diet. And this is not new information for most of you, but I did learn one new thing. I always try to learn something new when I'm presenting, and this is the new thing. You all know that saturated fat raises your risk for heart disease, right? And trans fats, they raise it. How about sugar?
Yes.
Now this is what I didn't know. If you're on a diet that has a lot of sugar in it, and refined carbohydrates, that's like white bread, and you take that all out and you replace it with saturated fat, which we know causes problems, your risk goes down. Okay, that is to say that high refined carb diets are worse for you than saturated fat in your diet. Okay? We know that saturated fat raises your risk for heart disease. Sugar raises it more. Okay? So I have all these friends who are vegetarian, and they think, wow, I'm doing really good, and then they eat a lot of sweets. Well, don't do that. As many of you know, this used to be an Adventist institution, and one of the founders of Adventism was a lady named Ellen White. And over 100 years ago, she made this observation. She said, it is better for you to eat meat than to eat largely of sugar. And she was right over 100 years ago. And we didn't know that for sure until 2 years ago, when Journal of American Medical Association published a lovely article showing that the researchers at Harvard had been bought off by the sugar industry in the 60s. Yeah. But now we have the data that shows that indeed she was right over 100 years ago. Sugar's worse for you in large amounts than eating meat. And we know without question now, I mean, a paper just came out within the last 3 months showing that chicken, beef, turkey, lamb, fish all raise your risk for heart attack over not having them. Now, chicken's a little better than beef, and fish is a little better than chicken. And so if you look at the data, people say, well, eat fish, it'll lower your risk of heart attack. And you always want to ask the question, compared to what? Right. If you compare it to the diet I'm going to tell you about, fish will raise the risk, not lower it. If you compare it to the standard American diet, it'll lower it, not raise it. It's just like saturated fat will lower your risk of heart attack. What? Yes, compared to sugar. Okay? But I don't want you to go out of here and say, well, Dr. Howe says you can eat all the saturated fat you want, because I'll tell you, you can't. Even if it's plant-based saturated fat, if it's palm oil and coconut oil, it'll raise your cholesterol and it'll raise your risk for heart attack. And it'll raise your risk for dementia as well. Question in the back.
So what is an acceptable amount of peanut butter and coconut oil if you're a vegan?
Okay, what's the acceptable amount of peanut butter and coconut oil? Coconut oil is a saturated fat, peanuts are not. Okay, but don't overeat nuts, because overeating any fat will raise your risk. But let's look at the diet itself. And since I mentioned sugar first, we're going to deal with sugar first. And that is, number one, diet must minimize glycation. I've talked about glycation before here, but I just want to revisit that. Glycation is what happens to your body in the presence of excess sugar. Anytime your blood sugar is above normal, glycation is happening faster than I'd like it to. You need sugar. Our body runs on sugar, but just like your engine in your car, if it gets too much fuel at once, it doesn't run clean. It runs dirty, right? And if you have an old carburetor and you rich up the mixture, what happens? Runs rough. Runs rough, and its smoke blows out and everything else. And if it runs too lean, you don't have power. Yeah. So you got to get the fuel. This needs to be turned down, but I don't know where the switches are. Anyway, if you, sorry about that. If you get the mixture just right, you get the most power, and it runs the best. And the same is true, thank you. The same is true with sugar. You need just the right amount, and your body takes care of that naturally if you eat sugar as nature provides it. I don't mind if you eat sugar cane, but not sugar. I don't mind if you eat beets, but not beet sugar. I don't mind if you eat corn, but not corn syrup, right? The body takes care of it if you eat what we were designed to eat, and that's whole plants. And sugar's not an issue. But if your sugar is above normal, you form this chemical bond called glycation, where sugar attaches to protein and sugar attaches to fat. And it does so in an irreversible manner and changes the very structure of the proteins and the fats. It stiffens them. Anybody here felt stiff before? When you get up in the morning, you're a little stiff. Why? Because your proteins over time have been glycated because you've been eating too much sugar. Aging is primarily the process of glycation. Now think about that. Diabetics, if they get diabetes at 50, lose an average of 9 years of their life expectancy. Why? Because high sugars on a chronic basis, causing glycation at an increased rate, age them faster. So diabetes is really accelerated aging from this process of glycation. And when it occurs inside the arteries, and so the arteries stiffen. Ever heard of hardening of the arteries? And stiff arteries, they crack, the inside cracks more easily, and if you get cracks in the pipes, then we have to patch them, and then you have inflammation, and then you have atherosclerosis started from this process of glycation from sugar being too high. So think about that the next time you eat a dessert, right? And make sure it's a high fiber dessert like your mother told you, eaten at the end of the meal after all the other good things that will slow down the absorption of the sugar so that your blood sugar doesn't exceed normal, so you don't have accelerated glycation, so you avoid a heart attack, right? Any questions about glycation? I could spend the rest of the time on glycation. It's an amazing thing. Here's just a list of the diseases or the conditions that are related to glycation. Anybody wear cheaters like I do to read? Okay? Why? Glycation stiffens the lens in the eye, and then you can't pull things into focus. And there's a really good correlation between your life expectancy and when you start to use these. If you start to use them at 45, your life expectancy is shorter than if you started to use them at 55, because we're measuring glycation. Macular degeneration related to glycation. Serious problem. Keep your sugar down. High blood pressure related to too much sugar, related to glycation. Congestive heart failure, same thing. It's related to glycation. Osteoporosis. You know, you can drop your calcium quite a bit and still have strong bones, but if you glycate the collagen, they become brittle bones because they're stiffened by glycation, and then you can break them more easily. And on the list goes. Anybody notice they had more wrinkles? It has to do with glycation. Yeah, how about arthritis? Degenerative arthritis. Yes, some of it's wear and tear, but if the cartilage gets stiff, that's glycation. So there's many reasons why you should keep your sugar intake low. Sugar's not a poison, but eaten in a way that you absorb it more rapidly than you can burn it or store it, you're going to accelerate glycation and accelerate aging. Any questions on that before we move on? Question in the back.
You said that this connection was irreversible.
It is irreversible until the body replaces that protein or that fat. And you've heard of cancer, right? Well, how does that happen? Well, the DNA gets messed up. Well, how does that happen? One of the reasons it gets messed up is because you can glycate your DNA, and that has to unspin, right? When cells replicate, and if it's stiff, there's more problems, mutations. So diabetics have much higher rates of cancer because they have higher glycation rates and they're glycating their protein. So really important. And that lady I mentioned earlier, Ellen White, you know what she said about sugar? Sugar clogs the system. Well, it does. It clogs the system. That was written in the 1880s. We just didn't understand it until the 2000s. And then the other thing that number 2, diet must minimize inflammation. You know, I emphasize this over and over again. Why? Because it's so important. If you want to avoid coronary disease, you minimize glycation, that's sugar, and minimize inflammation. And how do you do that? Well, you hire a whole bunch of firemen to come into your body and keep it from burning. And those little firemen are called antioxidants. Oxidation and burning is the same thing. And so you want to have antioxidants throughout your whole body. Particularly, you want them riding along with the fuel you're going to burn. Have you ever noticed trucks going down the highway and they're filled with gas and oil and flammable stuff, and right on them it reads in big letters, flammable. And they take special precautions when they come to railroad tracks and all of that, because hauling that stuff around is dangerous, and hauling fuel anywhere is dangerous, and that's true in your body as well. When you put fuel in your mouth, you got to haul it down to the stomach, through the gut wall, into the body, out through the bloodstream, out of the bloodstream into the cells, and all that whole time that you're hauling that flammable material, that stuff you burn to run around and think and all of that, you want antioxidants with it. Isn't it interesting that all plant food has antioxidants combined with the fuel to prevent it from being flammable? You're exactly right. And that's particularly true with fats. That's why, fats are the thing that can combust or oxidize on their own, right? You don't put oil in your cupboard, at least I hope you don't. You put it in the refrigerator. Why? So it won't go rancid. Nuts, they go rancid. Seeds go rancid. But nature packs them very carefully to try to prevent that. And that's why when you eat your fats, you want to eat them like nature prepares them. You notice that we had gravy this evening, cashew gravy, and you could have made that gravy with oil. But where are the antioxidants? Well, there are a few in oil, but there are a whole lot more in the nut, right? And that's why in this diet we try to have all the fats with all the fiber and all the antioxidants that nature packs them that way. It's less inflammation. Keep the inflammation down, and eat foods that are rich in antioxidants, and that's the colors, right? You want to eat the bright reds and the deep yellows and the deep greens. All of those are rich in antioxidants. If you want to eat one food that's really good at reducing inflammation in the arteries, it's greens. And Esselstyn, when he lectures, lists off about 30 different types of greens in machine gun fashion, just and names all these greens, because all of them will reduce inflammation, and that's what we want. So with the diet to reverse coronary disease, fats and sugars particularly that oxidize easily, you want to consume the way nature packs them with all of their antioxidants. Like berries. You couldn't do better than berries for your arteries. They're great. Those deep red colors are very rich in antioxidants. So minimize diet must minimize inflammation and maximize polyphenol antioxidants. And you also want to minimize oxidized fat and cholesterol intake. That's animal products, because no animal product has antioxidants of any amount in it. And what do you do? Anybody gone hunting for deer around here? Anybody shot a deer? Nobody? Oh, good, you have. So what do you do after you shoot it?
I gave it to my husband to clean.
Okay, you gave it to your husband and clean, and then what did he do with it after he gutted it and cleaned it? Well, he hung it, right?
Oh, yeah.
Why do you hang it? You age it, so it'll have better flavor and drain the blood and age it? Yeah, that's called oxidation. It improves the flavor. well, then you have an oxidized fat, but you don't stop there. You put it in your freezer, hopefully, and then you get it out and you cook it and you oxidize it further. And the same is true with fish. I've used this illustration before. If you go fishing and you pull a fish out of the water, what does it smell like? Nothing. It smells like water. You throw it in the cooler, you fish the rest of the day, take it home, take it out to put it in your freezer. What does it smell like? Fish. That's because it's oxidized. And then you eat that stuff? Yeah, that's why we don't recommend animals for consumption if you're trying to prevent coronary disease, because the fat's oxidized. And if the fat's oxidized, then you got inflammation, and then you've got coronary artery disease, and that's what we're trying to reverse. So we want to minimize oxidated fat and cholesterol intake, and you want to minimize the in vivo oxidation of fats and cholesterol. What does that mean? You don't want the stuff that your own body makes. Did you know most of the cholesterol in your body is what it makes? Your body makes cholesterol. Anybody want to stop their body from making cholesterol? I don't, because cholesterol is a basic building block of all hormones. Anybody want to give up their hormones? I don't. No, what we want to do is keep that cholesterol that our body's making from oxidizing. How do you do that? Eat your antioxidant-rich foods. That's how you do it. Colors. Eat the rainbow. That's where the antioxidants are. So that's 2. Let's go to 3. Diet must normalize flow-mediated dilation of blood vessels. Well, what's that? Well, that's what's at work when the patients that have coronary disease experience resolution of their symptoms within 2 weeks. Those arteries do not get back to normal in 2 weeks. They develop the ability again, or they develop the ability again to dilate arteries. You know, if you have coronary disease and you get chest pain, what do you put under your tongue? Nitro. Why do you put nitro under your tongue? Because the diet that you're eating so bad you can't make your own nitric oxide anymore. So you have to assist the body. But the body will make nitric oxide if you're on a proper diet. In order for it to make nitric oxide, nitro, you got to get rid of the fats in the diet, particularly oils. That's why on a diet to reverse coronary disease, you get 0 oil, as Esselstyn likes to say, not a drop. And that's true, because if you have oil, you reduce the body's ability to dilate arteries. And if you've lost that, keep your nitro in your pocket. Now, there's some other things that you can do to help foster flow-mediated dilation, and that's eat foods that are rich in nitric oxide precursors. And those are your greens that I've already mentioned. Gentlemen that have problems with impotence know that there are some medications that you can take that will restore nitric oxide production, you know, down there where you want it. And women, lubrication is the same thing as an erection. So if you're having problems with that, that's the canary in the coal mine. It tells you you've lost the ability to dilate arteries. And if you have problems there, you have problems in your heart too. So how do you do that? Well, you change your diet to this kind of a diet, and all then those things work well again. And that's good. I had a gentleman in my office today complaining of that kind of problem, and I said, well, we can fix that. He said, but I want a pill. I said, okay, you can have a pill, and then your vision will go green and blue, and you may lose it, but, you know, why not fix the problem? So he's going to fix the problem. The reason that you want to eat those foods that have nitric oxide precursors is so you can dilate your own blood vessels, and those are greens that are rich in arginine. The best is arugula, and beets are very high in arginine as well. Beets are so good at dilating arteries and improving blood flow that trained athletes, you take an Olympian and you put them on beet juice, their VO2 max, or their ability to do work or their sport, increases by 5%. That's huge in a highly trained athlete. So everybody's doping with beet juice now, and it's legal. You can do it with arugula. That's called the Viagra of vegetables. It works very nicely. And yellow watermelon, or just plain watermelon, but yellow's a little better, is rich in citrulline. That'll also help you. So you want to normalize flow-mediated dilation of blood vessels by maximizing nitric oxide precursors and minimizing, or better yet, eliminating refined fats, and there it is again, refined carbs and sugars. That will restore the ability to dilate those arteries. And then 4, exercise should gradually increase. Why is that? If you can exercise at 70% of your predicted maximum for an hour, you can eat a fatty meal, refined fats, and not lose your ability to dilate your arteries. But you got to exercise really, really vigorously for an hour. So the more fit you are, the less careful you have to be with diet. Now, if you already have coronary disease, don't try exercising really, really hard so that you can eat junk you shouldn't eat. I just want to point out that the fitter you are, the less likely you are to have coronary disease. One interesting study showed that men that could do 40 push-ups were all straight and low, bing, 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 like that, are at much lower risk for having a heart attack than men could only do 10. Anybody in here can do 40 push-ups?
I do them every day.
All right. That's awesome. I'm not worried about your heart. Anybody else? You know, I'm glad to meet a woman that can do 40 push-ups. Are those 50? Are those men's push-ups?
Yes, sir.
You're awesome.
Wow.
You know, that is, I can't do 50. I'm working on it. And
Started with 1.
yeah, well, good. If she can do it, we can all do it, right? Get those push-ups up. That's really good exercise. But even walking is good exercise. But start slow if you have coronary disease and gradually build up. And that's number 4. And number 5, the stress of life must be managed before it becomes strain. Are you familiar with the engineering terms of stress and strain? Here's a little bit. Someone said yes. We got an engineer here. Here's a little illustration. If you have a bridge, and let's say it's a country bridge, and it's designed to take 5 cars and 1 truck at a time, and it'll perform beautifully with the stress of those cars going over it. But if one day a great big Caterpillar D9 dozer comes along, and what's going to happen to that bridge when it tries to go across it? It's going to go from stress to strain, and it's going to start to bend, and it'll reach the breaking point, right? And if we knew that was coming along, we'd put some more supports under the bridge and that sort of thing. So I want to show you something here. I meant to bring a pencil, but I think this will work. If I take this fork and I put it under stress, as you put it under stress, stress doesn't deform things, but if you start to deform it, that's called strain. Okay? Have you ever felt deformed by stress? Yeah. So if you're feeling deformed by stress, you need more support, right? Because when I push on this fork like that, it doesn't deform much because it's got good support. But if I pick it up and do that, you go from stress to strain, and then you reach the breaking point, right? And you don't want that. There are a lot of things that we can do to support ourselves so that we can tolerate stress. We have it, all of us have stress, right? Coming out tonight was a stress. Exercise is a stress. But you don't have to go from stress to strain. You can do 50 push-ups, but if I said, now I want you to do 200 right now, that would go from stress to strain. And you might reach, I don't think you'd reach your breaking point, but you'd be deformed. We don't want that, because that's when heart attacks occur, when you go from stress to strain. And I don't want you to do that. So what are some of the supports that we can have that help us in times of stress? Can you think of some? Friends.
Meditate.
Meditation. Prayer. That's one I turn to a lot. Prayer. Others?
Yoga.
Yoga, yes.
Music.
Music, absolutely. Music can be wonderful or it can be really bad. Have you noticed that? Music is not neutral. Some people say, oh, music is neutral. Give me a break. There's some music, if I hear it, I turn that off. And it's a little different for each of us, but there are things that, cause more stress and do not support. And I think in our world today, there's some things we really need to seek out for support so that when we are stressed, we don't go from stress to strain to snap or breaking point. And I just really encourage you to seek out those friends, to meditate, to focus on the beautiful. All of that is really, really important. And seek out groups that are supportive. That can be helpful. For my wife and I, our children are not a strain. They're sometimes a stress, but they're a lot of support, and that can be good. Church for us is a big support, and that can be good too. But each of us needs to find what supports us the best. Because all you have to do is look at the news and then you need support, right? Yeah. Comment?
The word no.
The word no. Yeah, that learning to say no in the right situations can be really good. And learning to say no in a nice way. Yeah, in a nice way. Yeah. All right. Any questions before we finish for the night?
Just on the oils, so avocados.
Okay, so I didn't say fats, I said oils. Okay, I don't have a problem with fat. You need fat in your diet. You don't absorb your fat-soluble vitamins if you don't have some fat in your diet. I think you can go all the way down to 10% of your calories as fat without any problems, and that's really, really low. I don't think that's necessary. I think you can have too much fat, but if the fats that you use are not heated to high temperature and not separated from the way nature packs them, you don't have a problem. Let's look at nuts, for instance. Nuts can be glycated with roasting. If you have nuts that are raw, they have a glycated index of about 1,000 units per 100 grams. If you roast them, it goes to 7,000. And so using your nuts unroasted, why? Well, one of the things they do with nuts and why I don't recommend roasting them is they roast them in oil. Why do they roast them in oil? Oil's cheap and nuts are expensive, and it increases the weight, and so they can sell them to you for more. So if you're going to have nuts, first of all, as my good friend Martin likes to say, have them by the handful, not the canful. That works really well. About a tablespoon or two a day is the maximum that you'd want on nuts. But you noticed how few nuts were actually in the gravy and this tonight. And so you want to keep that down, and raw nuts are better. Avocado, not a problem, as long as you're eating the whole thing. Fiber is very anti-inflammatory for several reasons. One, it protects the fat from oxidizing. Two, fiber goes all the way through to our large bowel, and when the bacteria see that, they produce butyrate, which downregulates the immune system. So whenever you eat your fats with fiber, that's anti-inflammatory and a really important thing to do. The take-home lesson from this lecture is simple. Eat plants unrefined. Don't eat anything that someone's stolen the antioxidants or the fiber from, and you'll do fine. And that's really the answer to good diet, period. Yeah? Any other questions? Question? I have a question up front first. What's my take on stevia? Stevia is fine for a sweetener, but the problem with all sweeteners that are non-sugar is they trick the brain, and you taste the sweet, but no carbohydrate comes, and so the brain ups your hunger and you end up eating more. So I would rather you use a small amount of refined carb with a lot of fiber. My wife has a cookie recipe that does that, uses flax and oats and other fibers, and so you keep the actual sugar intake quite low, and it's really the carb-fiber ratio and the rate of sugar absorption and some of those things. But there's sort of an answer. I don't recommend any artificial sweeteners. Even though stevia is not artificial, it still tricks the brain.